Hey, what's up YouTube? What's going on? Just wanted to make a quick video here touching on the term osteoarthritis and the term osteoarthrosis because I feel they could often confuse people, and it, for instance, confused myself for many years, and it wasn't until recently that I really fully understood the difference between the two terms. And for the past several years, I've been kind of misusing them in a sense. While they are very similar, there is a slight difference. Anyways, the reason that this got brought up though is because I was looking at my MRI reports and my bone scan from 5 years ago. And on the MRI report, I was diagnosed with osteoarthrosis of my lumbar facet joints. So all my lumbar facet joints, I had a mild amount of osteoarthrosis. Whereas in my bone scan, I was diagnosed with trivial osteoarthritis in my right hip. And it got me thinking, so what is the difference between these two terms? And it seems so subtle because the prefix osteo means bone, arthra means joint, and then the suffix is difference. So itis implies inflammation, osis implies some sort of maybe change, a structural change, or maybe some sort of deformity. So anyways, I've been kind of doing my research this past week and trying to understand the difference, and it's very difficult to really find a clear definition of each term, because if you look at a lot of the definitions from the medical community and just online, they refer to them as interchangeable terms, or they refer to them as the same, or osteoarthritis is sometimes commonly referred to as osteoarthrosis, and it gets really confusing because everyone's kind of using the term osteoarthritis when it's kind of being used incorrectly per se. So I eventually stumbled upon a review from a professor, and his name is Panayot Tanchev, and he did a review on the terms and how he clearly explained kind of the subtle difference in how a lot of people in the medical community are misusing the terms. So when you look at osteoarthritis, it implies inflammation of the joint, because itis is implying inflammation of the joint, whereas osis is implying that there may be some sort of structural change or some maybe deformity. So when you hear terms like degenerative joint disease, the appropriate term would be osteoarthrosis and not osteoarthritis, because in osteoarthrosis, the primary cause of the development of osteoarthrosis is more of a mechanical wear and tear, or maybe cell death. Maybe there's a lack of blood flow to the area, or there could be some other maybe issues going on as well that could affect it. But inflammation is not the primary cause of osteoarthrosis. Yes, inflammation plays a role, but it's more of a secondary factor in the process, whereas osteoarthritis is implying just inflammation of the joint per se. And that's kind of this distinct difference, because when you hear many people in the medical community, or maybe you just hear commercials online about osteoarthritis or treating this condition, oftentimes this is kind of misinterpreted as a term, and they often will use that to describe degenerative joint disease, whereas degenerative joint disease is aligned with osteoarthrosis. So it's a very little kind of subtle misinterpretation of the terms, and it's more dominantly seen in more English-speaking societies, as per the review that Professor Panayot mentions in the paper that he wrote up here. And I'll post this review in the link below for anyone that's looking to maybe further understand themselves, or maybe it's not clear to you guys in this video that I'm explaining, so you can get a better understanding yourselves. But that's just what I wanted to kind of mention, because when I look back at my MRI and my bone scan, I was kind of wondering what's the difference between these terms, osteoarthrosis and osteoarthritis. And it finally became clear to me after reading this little review of the terms. And like I mentioned, the term osteoarthritis is just kind of being blown out of proportion in more English-speaking cultures and societies, specifically North America or the UK. But if you look to maybe some European countries, maybe even Russia, they use the term osteoarthrosis in more of a proper context. So I just wanted to kind of mention that because I've been kind of meaning to do a future video talking about my condition with regards to osteoarthrosis and how that's bothered me throughout the years subtly and how I've been able to manage it. And just something a little bit different because it was always a secondary issue to my disc herniation. The disc herniation was the primary issue that I had, but the joint issues are still something that from time to time will cause me some subtle issues, such as maybe some morning stiffness, a little bit of pain if I overdo it, maybe in the gym, or backache, but nothing significantly serious or anything like that. But yeah, just wanted to kind of clarify those terms though for anyone that may be curious and maybe just doesn't understand the difference between osteoarthritis and osteoarthrosis. So yeah, just to summarize again, once more, osteoarthritis implying inflammation of the joint, whereas osteoarthrosis, you're implying more of a degenerative joint disease where you have some degeneration occurring. There's some structural changes maybe occurring to the joint, and some maybe damage that has occurred. And inflammation is not the primary driving factor, rather it's more of a secondary factor, and it's more of the kind of continuous wear and tear on the body. So maybe mechanical overloading, maybe you're lifting too much weight too frequently, too much volume. That's what could cause an issue like osteoarthrosis to develop. And for myself at 20 years old, to develop a mild amount at all my lumbar facet joints, you could say that's probably pretty severe. And it just goes to show how badly I screwed up my back at the time for me to have developed a mild amount of osteoarthrosis at the age of 20 years old. So it kind of just puts things into perspective of how much I was overdoing it at the time. But yeah, just wanted to clarify those terms, and I will post the review of the terms in the description below for any of you guys that are interested and want to kind of get maybe a better understanding yourself. You can kind of check out what the professor says here in terms of how the term osteoarthritis is often being incorrectly used. So that's all I wanted to cover in this video, guys. Hope this kind of clarified things for you. And if you have any questions, comments, be sure to leave them below. And with that being said, we will wrap up the video. And until next time, guys, I wish you all the best and a successful and productive day. Take care.